had
over
forgotten about the parks.
it helps.
Oh, that's right, they are in that block.
Well, good luck with that. All right, it's July 9th and ready to hear Valeo's budget proposals. So, Bill, you're on, or whoever.
Well, good morning, Commissioners.
Morning.
Morning.
Yeah. This is my first time to appear before you since we started the social distancing, and so it's a little bit different time that we live in now. I'm Frank S. Henderson, Jr. I'm the past chair of the Valeo Behavioral Health Care Governing Board, and I get the pleasure of kind of kicking this off this morning with my esteemed colleagues from Breakthrough House and Family Service and Guidance. And to begin with, I'd like just to ask my team if they would introduce themselves.
Greetings, Buddy and Commissioner. I'm Bill Persinger from Valeo.
And the rest of the team.
I am Brian Knudsen. I'm with Family Service and Guidance Center.
Hi, I'm Brenda Mills of Family Service and Guidance Center.
I'm Karen Smothers. I'm the Director of Clinical Operations at Family Service and Guidance Center.
Good morning, I'm Tracy Keem, I'm the CFO at Family Service and Guidance Center.
Thank you. It's always a, oh, I'm sorry. Oh, no. I am so sorry, Stephen.
He's been thinking about it for a while. I want to hear it.
Yeah, and he's the new guy, so.
He's been rehearsing this.
Yeah.
Got my exercise in. Stephen Robinson, and I'm Executive Director with Breakthrough House. Nice to meet you all today.
All right.
Thank you. Well, it's always great to come before the commission, and even greater to come with our colleagues that are working together for the cause of mental health services. The main reason we're here today is to say again, we're honored to stand with you and the other county departments as we endeavor to ensure that our citizens, regardless of their circumstances, have access to excellence in local services for many years to come. We want to thank the Commission this morning for your leadership in establishing and maintaining public policies that emphasize an integrated approach to the public safety net of health, behavioral health, and social services. So our funding needs going into 2021 and beyond actually builds upon those integrative and collaborative policies. And we come to you this morning not asking for a handout, but a hand up to a level playing field where resources most closely match the demand that is before us. To get there, we three agencies bring resources to the table, allowing local dollars to be maximized and put to the best possible use in a way that's accountable, responsible, and fiscally sound. You will hear this morning about essential programs that actually save lives, help families stay together, improve health, reduce homelessness and jail time, educate children, reduce emergency room utilization, and help adults find work. The services that create these outcomes produce a cost offset in other areas of government and private sector operations, an offset that we ask be directed toward the local behavioral health care public safety net. Now, some of these essential services are in jeopardy to the economic shock of COVID-19 and compounded by the challenges of a system of care that's trying to meet the demand, especially from the uninsured. I know you understand that. Like other parts of Shawnee County government, behavioral health care providers have persevered through the pandemic, meeting needs in the faces of obstacles that we're overcoming because of our longstanding local relationships, and it has challenged us and stretched us to the core. Our local system of care is hurting because Medicaid hasn't been expanded to cover the uninsured. Third-party payer rates are nearly all paid at below our cost, and grants yet to thaw from frozen levels of the past. So, Commissioners, this morning our request for 2021 is $2.5 million. If granted, we would direct the flow of those monies, as we have done traditionally, to meeting the needs of uninsured persons seeking services from our 3 partner agencies. Now, each of the agencies represented here today will describe their service and data in detail and share with you their goals for the use of any increase for 2021 that you may grant. Now, for Valeo, the use of additional county dollars would be used to serving the uninsured persons in all of our required programming, but especially in our 24/7 round-the-clock crisis and addiction services. Last year, Valeo provided almost $1.7 million in unreimbursed charitable care to uninsured persons. We also would address health and behavioral health gaps highlighted in the 2020 County Health Improvement Plan, and also utilize these dollars for recruiting and retaining staff, prescribers, security personnel, techs, and counselors in our crisis and detox and other alcohol and drug addiction programs and staffing in other areas of operation. The ongoing methamphetamine crisis, as well as growing concerns about opioid abuse, are 2 areas also that would be addressed more completely. We do want to continue to maintain our outreach services to persons who are homeless and also maintaining our co-responder program. I'm very proud of the 3 agencies here today and how we've all pulled together, and I'm excited for our collective future, even in the face of a pandemic where recovery is possible for all who seek it. I want to thank you in advance for considering our request and for your services toward the greater good. I'm happy to stand for any questions before I bring on our CEO, Bill Persinger, for Valeo Behavioral Health Care.
Any questions?
I have none from Mr. Henderson, but thank you for your service.
Thank you very much.
Thank you.
Thank you, Frank. Commissioners, Betty, thank you for your time. I think you all have the latest draft of the document here. It's virtually unchanged from the one we sent. I am proud to stand here today with our partners, CEO Mills and Executive Director Robinson, and their volunteers and staff. The first several pages, I know you've had a chance to review, but kind of lays the groundwork for each of us, explaining a little bit more detail about our programs. The Valeo part shouldn't take more about an hour and a half, so I'll jump in real quick here. I do want to say that, you know, and we presented these data to you earlier in the year, the demand for the uninsured, and that's a word we've already, you know, stated several times this morning, and we don't want to overstate it, but it is true that with the spike in demand from the uninsured, which we think will continue, has really stressed our system. I know that CEO Mills and Director Robinson and I have all had conversations about the demand from the uninsured and seeing more and more people with more and more acute symptoms. And so you can see our challenges there for the public mental health system, not compounded by the COVID-19 pandemic, but you know, certainly workforce issues. I can tell you that therapists migrate from Valeo to other healthcare providers here in town, especially the VA. There's no way we compete when, you know, salaries are, you know, 10, 15, 20% more than we could ever pay. And so we have workforce issues, and not only with some of the higher paid staff, you know, licensed people, but, you know, staff to work overnight, second shift on a Saturday night. It's really, really tough even to find personnel, you know, paying $13, $14, $16, $17 an hour plus benefits even. So we are desperately trying to keep up with the workforce, which has become, you know, like with all organizations, private and public, even more stressed with the pandemic. And so I might refer you to page 4 as I go. If you have questions, shout it out. I'll be glad to stand for as long as you need me for questions. I just won't go through all the facts and figures, but I do want to point out, and we don't have aggregate data for Shawnee County. We have hesitated to spend the $20,000 or $25,000 it would take to give you a good cost offset figure like they've done in Wichita for the mental health center there, and Wyandotte County, the mental health center there has done some work on cost to offset data. But we know that when we put a social worker on the street at 2 o'clock in the morning with a cop, and they encounter sometimes a homeless individual, or maybe they respond to a call at a house, we know that we reduce the number of people who go to jail. And Director Cole will tell you, and I think he has before, that to keep a person with mental illness overnight is $300 versus somebody who doesn't have a mental illness who has to go to jail is $100 or so for their daily care. So we know that we've prevented arrests and jailings. We know we've gotten people to treatment. We know we've avoided emergency room placements. I just can't tell you quite how many today. And we know that every time somebody walks into an emergency room, it's a $2,000 or $3,000 that Brenda, being with Stormont, could probably give you a better figure than that. But it's expensive to have somebody just walk into an ER. We know we're preventing those kinds of things. The ERs tell us that, but we have not been able to afford to do a proper study for you. I apologize. Someday we will. We'll just say, all right, we're going to do that. But I want to emphasize that and I know that, we're probably not replete with funds, but if you can consider what's going on every day in behavioral health at the 3 partnerships and the cost that would be there if we couldn't function the way we do, and look at those dollars as a way to fund our request, we'd certainly appreciate that. And we're just trying to watch those data for you as best we can. So the co-responder is something that we're very invested in and want to see continue. We did 342 crisis screenings. That was an increase of 12% over last year. Last year was an increase over the year before, over the year before, over the year before. So that demand continues to go up. I can tell you that one of the ways we prevented some folks going to jail or having to languish in our local hospitals, and when they had to do it, the hospitals have done a great job, but since it's very difficult to get somebody into Osawatomie State Hospital right now, and has been for 5 years, made even worse in the last 6 months by the COVID, we're keeping people at our residence at 400 Southwest Oakley who have already been through due process. They have their ticket letter from the mental health center. They have a court order from a duly appointed judge. Both sides representing the county and the patient have agreed the individual needs to go, and they can't get in. I'm not faulting anybody, but I'm saying that the mental health center takes those people and keeps them. More than 50 of them last year. And so those are difficult people to serve. Their behaviors are critical and dangerous to self or others, and yet we've taken them. And we don't stand up here to brag about that, but simply to say if we were not able to fund that particular operation and all the crisis services that goes around it, including delivering medicine to people twice a day at their home, about 50 or 60 of them every day, we know that we're keeping people out of our state hospital, our local hospitals, our emergency rooms, and trying to get people to hospitals who really need to be there and keep the rest out. I really want to stress that. So we have been pretty fortunate that the state has supported the residents, but that's a combination of county and state money that we really do rely on. Just a few statistics there that you can look at as you study the need that we're asking for. We do a lot to help people find jobs, find a place to live, and that's really what we're all about. Our COVID-19 initiatives are described, and since CEO Mills and I reported to you a couple of weeks ago, speaking for Valeo, we're doing more and more face-to-face, although we still rely somewhat on telephone and televideo. I don't think it'll be our main form of practice going forward, but more and more staff are coming back to work and reporting in. We have reopened the addiction treatment services, running at about 60 or 70% speed just to keep the population from having too many people in the building. The crisis center is running at about half speed. Instead of the 32 that we could take, we're taking 16. So we're running 14, 15, 16 people, and demand continues to rise. And if that gets back up into the 18, 19, 20 range, like it usually is, 21 people, we will overflow to a couple of other group homes, for lack of a better word, that we have here in Topeka. So trying to meet that demand as well. We're very proud partners with Director Oakes and her team, Craig Barnes and some of the others at the Shawnee County Health Department, and working closely with Heartland Healthy Neighborhoods and other agencies to address the mental health concerns that were expressed in the CHIP. And so, at least from my vantage point, which is biased towards mental health and the funding of it, the stars are lined up. The public says we need mental health. The number one need: suicide, depression, isolation, lack of access, lack of awareness. Funders have stepped up and said, we want to help you do this. In fact, we just received a grant from one of the Medicaid managed care companies to keep a prescriber on board that we would have, probably otherwise in long range not been able to keep. So, for us, the stars are lining up. The demand is up. Public officials recognize the need, and the public recognizes the need, even to the point that it showed up in our county health improvement plan. In fact, not just one year, but in prior years, and we expect it to show up again. So, we really think this is the year that, we want to, what's the word I'm looking for? Validate that mental health is really a critical public service. It saves money, it saves lives, and I'll just not go on about that anymore unless you have questions. So proud of our health department, though. I know that Director Oakes, like I reported a couple of weeks ago, in fact, we were texting last night at 7 o'clock, and I've spoken to her early in the morning. Craig Barnes has been available to us, and we're just very proud of that relationship there. And thank you for your support to help us fund a health promotions position. That individual's on staff now, and they'll be directly working with the health department on those county health improvement goals that relate to mental health and some of the issues around it. Let me run through here real quickly before I turn it over to Family Service and Guidance Center. You can see some of the activities we've been engaged in on page 6 that directly relate to things that I think taxpayers would find important. What is the mental health center doing? Well, and I think all three of us are trying to do things that are practical, that make common sense to people, and getting services on the street, into schools, into people's homes, finding jobs, just those very common sense things that I believe very few other agencies locally are doing. And so we think we all three have a unique mission. So Frank has covered our need pretty clearly. We restate that here on page 7, again trying to direct it more and more towards practical programs that have value for people and have an immediate effect on people at 2 o'clock on Sunday afternoon or 2 o'clock in the morning on Wednesday. So we just try to be there for you folks. We never really shut down. We did close down part of our alcohol drug treatment program. We shared that with you a couple of weeks ago, and I think I'd shared it earlier in written reports to the commission. But that one decision right there cost us, I'll have to look it up, a couple $100,000 in lost revenue. And so we're just getting stung like everybody else. We can't stand up there and claim a unique need, but we do believe the stars are lined up. The public sees the need. Our policymakers need to see the need. The need has gone up. And I know that we all three stand ready to carry on and do everything we can. So with that, I'll stop. Commissioner?
Quick question on when you guys closed the detox facility, were there people in there that you let finish their kind of course of treatment, or?
We did.
Just throw your hands up and open the door?
Yeah. No, to my understanding, we finished that out, let people stay. In fact, my window kind of oversees the outside lounge area, and I could, even after we closed it, I could see people milling around out there. Instead of 10, 12, 15, I could see 3 or 4 or 5 or 6 and allow people to move on through. And I can double check, Commissioner, but I think we let them finish out their longer courses of treatment as well. So the detox is typically 3 to 5 days, and if people were in the inpatient or what we call residential, I believe we let them finish that on out too. We did help them find other resources. There were some programs I know that in the area that remained open, and we just felt like with the design of our building, the way the hallways are constructed, I mean, we didn't foresee this 30 years ago when we built that building. Right. It's a fine building, still one of the better facilities I think in the country here in Topeka. All three of us have some great facilities, but it just felt a little too crowded, and we just felt like for everybody's safety we had to close that down. Now that there's a resurgence, and people are kind of bought into the culture of wearing masks and washing their hands and doing this and doing that, I don't foresee us closing that again, and not so much because of the money, because we think we just learned what really transmits this disease, and trying to be very, very careful.
Yeah. I wanted to ask also on that co-responder program, which I think is a fantastic program.
Thank you.
What percentage of the work goes into with TPD versus the sheriff?
Sheriff's Department. Most of it ends up being with the TPD. We do have some responding from the Sheriff's Department. Commissioner, I would say the vast majority, 70–80%, is probably with the TPD, if not more.
And does the city of Topeka help out with the costs on that at all?
They do. In fact, I've got a meeting with Sergeant Clam coming up here after this meeting. He and the chief and I have been putting our heads together on how we can fund that going forward. Our state grant that funded one of the shifts, plus some extra shifts on the weekend, expired on June 30. We expected that. We knew it was coming for a couple of years. And so I don't think we're operating third shift right now as it used to, and I can describe how that works. We're still available 24 hours a day. It's just we dispatch a crisis case manager if the police call third shift. So we're covering first shift and second shift right now with existing funds, including help from the Sheriff's Department, and trying to remember if there's city money in there too or not. I think there is some city.
Sheriff and the jail.
Sheriff and the jail are both putting in.
I don't know about city.
Yeah, I'll check on that. I
thought
think
they
we're
were-
carrying that. Yeah. I believe they are,
Pitching
yeah.
in a piece too, I
Yeah.
believe.
And I'll have more information about that afterwards. And so we're running first and second shift, and we've maintained the two 12-hour shifts. They're kind of mid-shifts, cover part of second, third, Saturday and Sunday with a licensed person who's on call. And now for a while, we didn't go out in squad cars with the police. We just felt like it was too close, and we're starting to do more and more of that now. But we'd meet at a site, help the police work through a situation, but most of that's with the TPD. And I am hoping that, they'll see their way clear to put in more funding for that, Commissioner, and I will check on that and be vigilant about it.
So you mentioned that they're not riding in the squad car any longer. Is it sort of an on-call position where they just,
Well,
you sit at home with a
third
beeper
shift,
and-
yeah, third shift is on call. We've got crisis case managers on duty around the clock. Now, first and second shift, we're starting to get back in squad cars again, now that we've all learned how to distance and do all those things, so, yeah.
Okay.
Yeah, but typically it's been in the car, on the street, kind of a responding program. Third shift for a long time has been, they're out there and we're at the crisis center at 400 Southwest Oakley when they come by and, we'll go out together, we'll respond together, meet at a place, work things through, talk on the telephone, whatever it takes. So we've always found a way to be supportive third shift.
Thank you.
Mr. Chairman.
Yes.
Bill, just a couple of questions.
Sure.
What was the reason for the not having it on third shift? It would seem to me that we would have more crisis calls in that midnight hour, so to speak, as opposed to 10 a.m. Was that part of it, just trying to make sure we had people on staff at the appropriate times? So what was going on there?
I think the TPD reorganized its behavioral health unit at some point in the last 9 to 12 months. Because I think there was more interaction, third shift. And I know that didn't slow down our responding. I mean, no cases are left unanswered at third shift. I don't want to leave that impression. Even when we're not covering the 12-hour shifts on a weekend, if something happens at 2 o'clock on Saturday morning and there's, we have crisis folks available to consult and work directly with cases. I think it had more to do with staffing, changes at the TPD, and not a bad change of direction, just a reorganization and a change of direction. And surprisingly, most of the calls were happening first and second shift.
Okay.
That's where the bulk of it. In fact, when I got here, I think we were only doing first shift, and we had nearly 900 contacts, face-to-face contacts with the police, first shift, Monday through Friday, 8 to 5. And then I think the height of it was around 1,400 contacts a year. The bulk of that still remaining first shift, if I remember my data correctly.
As long as the data is, that's what it's showing. I mean, that's one of the, again, just being a layperson, I would have assumed
Yeah, you'd
more
think.
at night, in the middle, or as opposed to during the day. But
Yeah.
again, if that's what the data shows, that's where you want to apply to where the data is reflecting it.
Yeah, and we've made a pretty strong commitment to first shift, kind of regardless of funding. Things get too bad, we may not be able to do that with a dedicated person, but the point about that is no matter, even if things melted down totally and there was no official co-responder program, we have a way of co-responding
Sure.
with our staff who will always be on call. So it's by virtue of our license, we consider it our #1 duty. In fact, if the world melted down around us, we would offer crisis care, detox, and prescribing. I mean, that's kind of the stuff that no one else can absolutely step in and do. So we've always found a way to respond, Commissioner, and always will. Depending on how things go, it could look differently. We hope not. We're working hard to maintain the structure that we have now.
Sure.
It works very well.
The other question that I had, looking at our mental health providers in Topeka and Shawnee County, you have the VA center, and they are all going to be covered because they're veterans. You have Family Service and Guidance, and the vast majority of their clientele, it's my belief and assumption, I'm sure I'll be corrected if I'm wrong, is either covered by some sort of either state insurance or their parents' health insurance, so there's some recovery on that. Breakthrough House, we have a majority of their clientele are either on disability or qualified for some state recovery, so we have a recovery rate there. It would seem to me that Valeo is addressing the majority of our uninsured or underinsured, if they are, because of their addictions or mental illness, are unemployed or not yet qualified for disability. you're going to be taking on a bulk of people that you will have no recovery for. Am I misreading the landscape, or maybe can you define it for me a
Yeah,
little
no,
bit?
I think you're correct about that, and I know that the other two agencies are, making a real stretch there too, to serve the uninsured and the underinsured, but it is pretty typical of adult mental health programs to have to shoulder that burden. Most of our clients live on incomes of way less than $20,000 a year, and haven't looked at that lately, but, and that's kind of our point about, Medicaid expansion. We figure conservatively another $500,000 a year for Valeo if Medicaid would expand, just for doing what we do now.
Out of the 2020 funds, $1,215,689 was allocated to Valeo.
Right.
Of that, could you kind of give maybe the commissioners or myself just a rough estimate on how much of that is reflected of uninsured, underinsured? I mean, is that what a bulk of this is going to, is paying that clientele and providing services for those clientele?
If those dollars, another way to look at it, if the 1.2 million Valeo share wasn't there, our uninsured burden, and I don't use that word negatively because that's what we do, we accept that charitable burden, would be, you'd have to take the 1.7 million, add 1.2, would be, nearly $3 million. And so those dollars, we've always considered those dollars to offset the uninsured burden and allow us to offer those basic services, particularly those that, are 24-hour based and crisis based.
Do you have
So
an
it just-
idea of the overall percentage of Valeo care that is the uninsured, underinsured?
So of our clients, that number runs around anywhere from 27 to 38%. And I don't know what it is standing here today. The chart we shared earlier will show you that skyrocket in not only the number of people, but the demand for services. In fact, quite a bit of demand at the crisis center from the uninsured. And the other thing that's very difficult to measure is the underinsured. People who come in with a third-party payer, private commercial insurance, and and it will cover counseling and medicine. But that's not the bulk of what either of us do. And so we've got that group of underinsured people that is a difficult burden to measure, mathematically. But we know it's there because we tend to serve those people whether insurance covers it or not. So they become virtually uninsured. So, and they're not, it's not part of that 1.7 million. So.
All right.
But yeah, we do shoulder a lot of the uninsured burden by the nature of how we're set up. It's just,
It would just seem to me that your clientele are more uninsured and underinsured.
That's correct.
Than Family Service and Guidance or Breakthrough House. And again, not being,
No.
but just recognizing that you have a larger clientele base that's underinsured or uninsured.
I think that's that's probably true. I don't know about a head count exactly, but in terms of the uninsured financial burden, yeah, and yes, I would agree with that.
Okay.
What's the average stay at your facility?
Well, so detox runs 3 to 5 days. The crisis facility is 3 to 5 days, although that has crept up in past years with the moratorium at the state hospital has a direct effect on us. And I'm not sure what the average number of counseling sessions is, Commissioner. I should have that data in my head, and I just don't. But the crisis facility, the detox facility, generally a 3 to 5 day stay, and that's been creeping up some. So the inpatient alcohol and drug treatment program is a standard 28-day program. People stay, and then they come in for what's called reintegration care or aftercare, and so.
Commissioner Mays?
Bill, do you guys share information with law enforcement of trends that you're seeing? Like, if you're seeing people coming in on heroin, do you tell the police, like, wow, we're really seeing an increase in this lately, or?
We do. We have several avenues to communicate that. So we meet every other month in what's called we don't have a fancy name for it, it's called the Mental Health Plus Law Enforcement Meeting, and city and county representatives are there, and we've kept them both up to speed on the methamphetamine crisis, and I think if both of our sheriff and our chief would probably tell you that's the number one problem we do. We are looking at about 10% of our alcohol and drug caseload being opioid or opiate connected to heroin, opioids, that kind of thing. So that's kind of an increasing concern for us. We're doing some work with PARS here in town, Michelle Voth and her group, on understanding the scope of that problem. and there's a team involved there, Sergeant Clam serves and others. So, quite a bit of communication going back and forth with the Sheriff's Department and the jail and the TPD on just what's going on out there. And some of it on a case-by-case basis as we encounter people who actually need help. But I think if the 3 or 4 of us are sitting just chatting, having a cup of coffee or whatever, I don't think they would say a whole lot different than that. There's quite a bit of communication going back and forth and some coordinated efforts. They've assisted with the drug take-back days that we did. And a couple of years ago, we did 2 or 3 of those. The health department and others helped out. Since then, we've found some bags called Deterra. Individual can take, put their medicine in it, it disappears in a few hours, you throw it in the trash. So we don't really need to do drug take-back days like we used to. There's a lot of cooperation there. But quite a few ways that we interact with law enforcement. And of course, I want to mention the courts. The district court has been, and the municipal court have been very good about our cases involving behavioral health, mental illness, and addiction. We have one of the few drug courts here in the city of Topeka, or mental illness courts, alternative sentencing, and one of the few drug courts in Shawnee County in the district. And that's working very well. The judges, both Judge Anderson now and Judge Bixel and others, Judge Wilson, were all just super available, even in the middle of the night, to conduct mental illness hearings. And that takes coordinated effort between the DA's office and the mental health center and the police on the street, the sheriff's department, and the judiciary. And great deal of cooperation there. In fact, we'd be in a world of hurt if the court if we didn't have access to judges like we do now, just 24 hours a day. It's been outstanding. And I think CEO Mills and I could probably both tell you of situations where that isn't always true across the state. We hear some of our colleagues say, well, this is good, and this isn't, this is good, and that works. We're really blessed here, Commissioner.
Thank you.
Yeah. Any other questions?
No.
All right. Thank you, Bill.
Well, thank you. Take care.
All right.
So I'll introduce Brian Knudsen from Family Service and Guidance Center.
Okay.
Good morning. As Bill said, my name is Brian Knudsen. I am the past chair of Family Service and Guidance Center, and I have some just real brief remarks, and I'll keep this short. With me today, you've already met them, but I have Brenda Mills, who's our CEO, Tracy Keem, who's the CFO, and Karen Smothers, who's the Director of Clinical Operations. As a quick reminder, FSGC is a licensed community mental health center that specializes in pediatric mental health. We provide a variety of outpatient services, outpatient therapy, psychiatric, community-based, and crisis services. You'll find our staff working in collaboration with families and children at schools, pediatricians, law enforcement, juvenile corrections, child welfare, TARC, and more. FSGC employs about 270 staff, and those individuals provided about 220,000 hours of services to just over 5,200 children last year. Brenda will have some additional information for you later, but I wanted to share about how the board and the community are appreciative that FSGC was quickly able to shift its services to televideo and telephone so that clients could continue their therapy and medication appointments without interruption. And also that our employees were able to quickly shift to working safer from home during the first few months of COVID-19. During COVID-19, FSGC continued to provide crisis services. However, community-based services had to be suspended. This meant that some of our most vulnerable clients did not have their wraparound services available. Additionally, school-based services had to stop as well. And while some of these services have restarted at this point in time with additional safety protocols, the fiscal impact has been significant. During FSGC applied for and received funding from the Payroll Protection Program, which has allowed us to keep our staff employed during this time. The staff has been great about applying for grants and any other relief they can find to help cover additional costs of technology for providing remote services. The staff has provided the board with their fiscal recovery plan, and they monitor the progress weekly so adjustments can be made quickly. Still, the impact of COVID will be felt for a very long time. And the great unknown of what will happen with schools when schools open this fall is it makes it very difficult for us to plan for consistent services and consistent revenue projections. And now, with everything going on, more than ever, it's a time for us to attend to mental health. As past chair of Family Service and Guidance Center, I ask you to consider the impact that FSGC, Valeo, and Breakthrough House have on the recovery of our community. We need to help prop up our families as they struggle with the inevitable mental health crises that will occur from loss of employment, illness, or just the prolonged stress of wondering when this will ever end. On closing, on behalf of Family Service and Guidance Center, I would like to thank you for the support of the public safety net for youth mental health services. If you have no other questions for me, I would turn it over to Brenda Mills.
I don't have anything for Brian. Thank you.
Thank
Thank you
you.
much.
Good morning, Commissioners. Good to see you again. I know I went over a few things with you a couple of weeks ago, so I'll try not to repeat some of that. But I did want to reiterate that during, the issues that we've been dealing with most recently, I think, are just kind of top of mind. And when I looked back at the application that we made to you, it seems like it was so incredibly long ago. So I really want to just kind of hit on some of the things that we've been doing most recently, because this is what's going to guide us moving forward. During COVID, we did not see a reduction in the use of our psychiatry and medication management services. In fact, using televideo and telephone services really actually increased the use of those services. And so families were really taking advantage of making sure that their children were staying on their appropriate regimens. And that's, I feel, is a testament to the commitment of our families to keep their children healthy, and that our psychiatry department was able to meet their needs very quickly. Another service that we saw in great demand during this time is our parent support services. These are services that are provided to parents of children who have a serious emotional disturbance, and they have saw a very large increase during COVID, and again through televideo means. Our crisis services did, as you saw the graph that I provided a couple of weeks ago, did see a very large increase during the stay-at-home order, and fortunately, still, knocking on wood, we've not seen increase in suicide or suicide attempts. And I mean, that's just, I'll just say that's great news. And our services continue to be provided 24/7 for any kind of crisis services. We were not, however, able to continue our respite care services, which are sort of a one-on-one services provided at our crisis house, and we're still not really doing that. Those kinds of services are really kind of what keep families together sometimes when you've got a really challenging family. And so we've got to find a way that we can start providing those services even in the midst of COVID. The clients who probably struggled the most during this time period, however, were our children who have serious emotional disturbances that need to have face-to-face community-based services, and our autism program kids, because those are the ones that had to be face-to-face. As soon as we were able to open those services back up, there was a rush to services. Families are very eager to have their children back in those services, and so far, I think we're doing as good as possible. We're not back up to pre-COVID levels, but within the constraints and the protocols we have, we're providing those services safely. One thing I wanted to share that was brought up by our psychiatry department this week is, as parents are starting to return to work, they're starting to see some additional struggles that they weren't seeing during the shutdown when everybody was home. Parents are having to go back to work. They've got financial pressures, and sometimes it's easier just to pick your battles when the kids are really creating some havoc at home. And they've got to pay the bills, got to pay the rent, so the kids are just kind of running amok a little bit. This is kind of the impression that the docs are getting from some of our folks. And so they're really very concerned about what's going to happen when school comes. And there's this, there's going to be a variable kind of school setting. And some children are going to be being at home, some are going to be online. And some parents don't have the capacity or the capability of teaching their kids at home. And the beginning of school is always a challenge for our children that we see anyway. And I think there's great concern that if we're not very actively involved with some of these kids, that they're really going to kind of decompensate when school starts. And the anxiety issues that could come up from just being in a classroom and one of their teacher or a classmate tests positive, and just, you can kind of just see how this is kind of going to mushroom. So we're really working hard on how we're going to be able to work within the school setting. Those were services we had to stop providing when the schools shut down too. So We're just kind of in this, I mean, we're planning, but we're in this kind of rocking area right now. As Brian did mention, we sought every available resource we could get related to COVID, and we know that the county has your own challenges as well. I would just ask that you do whatever you can to help to support the public mental health system. The loss of employment is, of course, going to lead to more uninsured needing services, and we do serve about $500,000 worth of uninsured and underinsured services, that even with kids who primarily can get on other services, other pay sources, but we do have about $500,000 that we have to cover, of which the county provides a significant portion of that. We do have some great concerns about unreported domestic abuse and child abuse that's maybe happening out there, because we've not had eyes on kids for a while. And so it's just really imperative from my perspective that we have to support the public mental health system to help our community move forward and help our families get through these struggles. I'd also like to share, I think Bill did mention this, the state of Kansas in their allotment process is cutting any new funding that we have for community mental health centers. So our grant funding increase, our Medicaid rate funding increase, increases for our ability to have additional mental health teams in schools. Those are currently on the chopping block. Anyway, just so you know that those sorts of things are probably going to be a problem for all of us. As much as COVID has been a big bump in the road for us, we did have some really great things that have happened this last year. Our autism program is still continuing to grow, and as good as we can. There's some additional challenges with that program. We continue to do our real-world parenting series, and did that during COVID, had great participation by Zoom. We're back on track working towards our CARF accreditation. That took a little bit of a detour, and something we were excited about last year, we were able to hire another board-certified child psychiatrist, and those are rare breeds out there, and she's really fantastic. And so that's been another resource we've been able to bring to the community here. Family Service is always kind of looking to the future and looking at the situation we're having right now, and how can we use what we've learned to improve our services in the future. So things like telemed, we hope that can be a permanent situation. It helps families who have transportation issues, and it shifts costs from facilities to technology. And so, like many businesses, we're looking at our facility uses, and we had planned for a facility expansion that's now on hold, but post-COVID, we're going to have to go back and look at reinstituting our plans for a facility for a juvenile crisis intervention center and an expansion of our crisis facility. Those needs are not going away. The community still needs that, but we've put those sorts of things on hold. And again, as a reminder, the community health needs assessments always mention mental health as one of the top priorities for the community, and that was pre-COVID. We know it's going to increase now. Funding from you guys helps to support the uninsured, helps to support crisis, our psychiatry department, our suicide prevention initiative, which has been very well received and very much a part of the school systems now. Any of our workforce efforts, as Bill mentioned, trying to retain staff and pay them an equitable wage. We have strong competition from Missouri, which has a different funding system for mental health centers, and they seem to pull a lot of folks from the eastern part of the state over there. Anyway, I will just say, thank you for your continued support of mental health. I hope that you're proud of the work that we do for the young citizens of Shawnee County. I'd like to think that we give you a good product, and that you should feel good about expanding the support. So, questions? I tried to talk as fast as I could.
Brenda, this Valeo helps get some offset through the city of Topeka on some of their crisis responders. They have some offset with the alternative sentencing court and some programming that they do. Does the city of Topeka have any contributions that they, or programs that they do with Family Service and Guidance?
No.
Did they used to, and then it's been cut, or just it's never been there?
It's never, I've been here for 30 years, and we've never had city funding.
Okay.
Uh-huh.
I'm just
Yeah,
Just
it's-
asking,
Yeah, we did used to have some funding through juvenile corrections, through the funding that was approved by the JCAB. And
Mhm.
that is something that will, as we move into this Juvenile Crisis Intervention Center, I think they'll hopefully have money that's tapped to support that through the juvenile corrections side of thing, which is really a county,
Okay.
state,
well, I know that
county sort of.
Tim Phelps yesterday was talking about even that being cut
Yeah, yeah,
from the state.
yeah.
and that-
Everything that's new is.
And that the juvenile education part, that's gonna be maybe cut by the state after the Senate bill, and,
Yeah,
so anyway, all right,
Yeah.
just asking if there was any allocation.
yeah. And most of our external support comes from, we're very active in fundraising, and so, we have a couple of big fundraiser events that contribute probably $150,000 to our operations each year, and we do have a separate supporting foundation that we take the earnings off of each year, and that foundation allocates that back to Family Service and Guidance Center. That's all dependent upon how well the market is doing. Some years, it's been a couple $100,000, some years it's been negative.
Mhm.
We had a very generous benefactor that gave us money many years ago, so we take the earnings off of that to help support our early childhood programs.
Sure,
Yeah.
all right.
Commissioner, if I may, I neglected to mention Brenda's comment and your question made me think the city of Topeka puts in $230,000 a year for our detox program, and I just forgot to put that out there on record.
Are you anticipating that being cut due to the budget issues with the city?
We sure hope not. I haven't gotten any indication of that, Commissioner. We will keep you posted, though. That's a program that benefits everybody in the county, and we just wouldn't have that program were it not for the city, and just like we wouldn't have any of our programs were it not for you folks.
I just know that a lot of times when the city looks at their first cut, social services is usually the first cut, and not just the city, but any governmental agency.
The juvenile program, what's the age range there? How low do you go on, as far as the age?
Do we have any 3-year-olds?
Are you talking about juvenile for all of our services, or?
Yes.
Yeah, we will see as young as 3.
As 3.
Even younger for our autism program, which can go even to 18 months.
Okay. All right.
Yeah. Generally tops out about 18. Children who are on the SED waiver can stick with us until they're about 23 for certain services. And and then those that are going to transition to the Valeo system, we have coordinated folks that connect them up, those that are going to fit into the SPMI arena.
All right.
Any other questions?
No.
No?
Okay, Stephen
you, Brenda.
Robinson.
I just wanted to mention one thing,
Oh,
because I
sorry.
was thinking about, and I'm doing numbers in my head, because that's what I like to do. But Bill had mentioned that a lot of our rates don't cover the cost of the services, and
Oh, yeah.
Brenda mentioned that we do about it's 500 to 600,000 that we write off for sliding fee scale. But another example I wanted to give you is that psychiatry, for every $1 of reimbursement we get for a service, it costs us about $2.35 to $2.40. And so we support over $1 million in the shortfall of psychiatry with some of our state and county funding. And so over 40% of our state and county funding goes to support that.
Yeah, thank you,
And
Tracy.
so I just wanted
Yeah.
to.
And,
Thank
and,
you.
yeah, I'm glad you mentioned that, because she's always got the numbers in her head, but, child psychiatry is just such a critical piece of what we provide at Family Service that many other mental health centers around the state do not have, or they have to do it all by televideo with somebody from elsewhere. So it really is kind of a jewel and a thing I think people in Topeka maybe do not realize is very, very rare. I know Stormont Vale Behavioral Health Outpatient has child psychiatrists, a few, and they primarily work with the folks that are in the hospital, but our team is swamped all the time, and it is something that we underwrite, and many mental health centers have had to go the route of, we just can't afford to keep psychiatry going at that level, and so it is a net outlay big time, but it's for the good of the kids and the community and the parents. So, anything else?
No, thank you.
Thank you all. Okay,
Thank you very much.
Thank you. I was really glad to do that.
Thank you, Commissioners, for having Breakthrough House represented today, along with our partners. Unfortunately, our board chair was unable to make it today. She's quarantined until Saturday. So she asked if I could read this to you. And I better put my glasses on to do that. Hello, my name is Sheena Ward. I am president of Breakthrough House Board of Directors and have been serving on the board since 2016. On behalf of the Board of Directors, staff, volunteers, and consumers of Breakthrough House, thank you so much for the financial support you have provided to us through the year. We are now well into our 42nd year of serving the Shawnee County residents who live with severe and persistent mental illness. Breakthrough House is extremely grateful for the steadfast support we continue to receive from Shawnee County in support of our mission. In each of our 3 major programs, Clubhouse, Residential, Payee services, the emphasis has continued towards helping each of our consumers, each person, to discover their own special talents and interests. This discovery can spark a person towards increased levels of motivation and self-awareness, enabling self-esteem to soar to new heights. Our mission is to empower our consumers to live independent, impactful lives. And our dedicated staff helps our consumers move closer towards a higher quality of life each and every day. We strive to provide our services efficiently, always trying to keep expenses down and under control while operating the fund dollars we receive. With addition of our new executive director, 35 years of nonprofit experience, and our new clubhouse director who has 29 years of experience as a licensed master social worker degree and former faculty member with Clubhouse International, both bring a level of success to Breakthrough House that will continue our program numbers. Combined with our other seasoned payee program and residential manager of 15 years. Our main outcomes continue to focus on increasing the stability of our consumers so they can more easily avoid admittance into crisis centers or mental health facilities. In 2019, our residents remained stable and out of a mental health facility, 98%. Last year, 90% of Breakthrough House consumers avoid having issues with law enforcement. Reducing consumers' misuse of illegal drugs and alcohol in 2019, a remarkable 100% of our residents remain clean and sober and out of jail. 95% of our payee program consumers stayed out of jail and involved with law enforcement. 94% of our payee program consumers stayed out of mental health hospitals or crisis facilities. Our program worked towards improving these outcomes by providing a safe place, including Clubhouse, for our consumers to go during the day where members can feel safe, learn social activities, social enterprise, and participate in activities that enrich their lives. Providing safe, clean, and affordable housing with social includes a safe and supportive environment for our housing residents. Provide experienced, caring staff who gently encourage independence while also providing an ear to hear our consumers' issues and concerns. And our rent and utilities are paid for those in the payee program, which helps to lessen a consumer's chance of becoming homeless while also increasing neighborhood stability. Shawnee County funding in 2020 would be used in the following priority areas: continue to provide safe, affordable housing for our consumers, increase the amount of fresh fruits and vegetables in the daily menus of our 2 group homes, provide reliable transportation for the residents of our licensed group homes for various medical appointments and field trips. A list of our community partnerships include the following: Valeo Behavioral Healthcare, Harvesters, Shawnee County Masters Gardeners, Veterans Administration, the County Probation Department, Baker University of Nursing, Washburn University, student interns, Fellowship Bible Church, Topeka Police Department, Rescue Mission, and Kansas Clubhouse Coalition. Thank you again for this opportunity to come before you. Breakthrough House appreciates your consideration and past support of our three main programs that will continue to grow in the future with Shawnee County support. Stephen Robinson is present to provide answers to any questions.
Questions?
No, Breakthrough House is just one of those key programs in Shawnee County to keep people active and engaged and, again, off the streets, and so that they have a safe place to go. So looking at that, the persistent mental illness clients and working with them. So, and the payee services is a great addition too.
Thank you for your comments, Commissioner Cook.
Thank you.
Thanks, Steve.
Thank you.
Any other comments?
About out of time, anyway.
Well, we're about out of time, so thank you for coming in.